And I'm going to be recording this session. I forgot to on my last webinar and got scolded for it. And so far I have, let's see here, Stacy, Randy, Amy, Jenna, and Laura. Everybody here? Oh, and Leah. And as long as you have a quiet background, I'm fine with you unmuting for the duration of the chat here today. If you have a noisy background, then, you know, Zoom etiquette is go ahead and unmute so I can unmute you guys, or you can do it yourself. But definitely operate a lot better when it's, you know, engaging and people contribute and ask questions and participate. That's really the basis of why we started these community outreach once a month, is to be able to pick a topic and then see what kind of questions, you know, the community or our patients or whatnot have to ask us about that particular topic, and then chat some more about it. Grab one more book and then we'll get started. So today's topic that I chose was basically a spotlight on botanical medicine. I feel really passionate. Can everybody hear me, by the way? I know that Stacy said she could and Randy said she could. I want to make sure that Leah's got a thumbs up. And I don't have video for a lot of the other folks. So Laura's got a thumbs up. Thank you. So there is a group chat as well. So if you don't want to unmute yourself, you can go ahead and type messages over there. Hopefully everybody, like I said, is pretty familiar with Zoom etiquette at this point in the pandemic. I think we've all been Zoomed out. But I appreciate you being there. For those of you who don't know me, my name is Dr. Karin Duncan. I'm a naturopathic physician here at Coeur d'Alene Healing Arts. And we just, like I said, started these online group chats to be able to support our community and do some more outreach about the medicine that we feel really passionate about. Today is a spotlight on herbal medicine. And again, I prepared a few things to just kind of chat about when it comes to herbal medicine or botanical medicine, if you will. But I always love to open it up to questions because, again, we're here to serve you and your questions and see how we can facilitate that conversation. So if anybody has a specific question, please feel free to either chat or unmute yourself and ask away. Okay, so on a Friday, everybody just wants me to talk and wants to listen, which is also fine. So I'll start going. Again, I have my chat box up, so if you have specific questions, please let me know. I think I'll start, you know, really with a basic introduction of botanical medicine. I mean, it's been around for thousands and thousands of years. As long as man has been on the earth, we've been using herbs and plants, whether we know it or not. I mean, we breathe in the oxygen that plants breathe out. So we truly need plants to live in synergy on the planet. So I think it's a really important relationship to have, and it's an important medicine to harness. A conversation I have a lot with my patients is I have, you know, quite a few people come in on a lot of supplements, 10s, 20s, 30s, sometimes in the 40s. And what I typically see is I beat the drum of quality product, therapeutic dosing. We have really extended research into botanical medicine, especially within the last decade, to show that, yes, just as if you are prescribed a certain pharmaceutical at a specific dose to get a certain therapeutic effect, we also are seeing that with our botanical medicine. It makes it a little bit harder to standardize because certain herbs grown all over the world are going to have different nutrients based on the soil and the climate and their food product and the environment there to create different potencies for their medicinal actions. However, we've made a lot of progress, like I said, on the research front of it to show, hey, this is what we need to get a desired effect in the human body. Not only is there really effective dosing and therapeutic dosing out there, but quality product. I chatted about this, I think, at my last Zoom call, but it's another thing that I'm passionate about, is that the FDA does not regulate supplementation. In that vein, your naturopathic doctors do a lot of work and research to find quality products that actually contain the amount of nutrient or herb in the product that is marketed on the label to make sure that you are getting the medicine that we're prescribing to you. So not all supplements are created equal, and definitely not all of them are distributed, stored, and maintained in a proper environment for their efficacy. Herbal medicine is largely dependent on how we extract the constituents. So a lot of plants work best when you use the whole plant and you use the leaf, the root, the flower, and extract it all as one and put the whole plant into your body. I tend to think that this works, the most parallel with the human body and physiology when we do it that way. However, as we know, we've extracted constituents from medicine, as far back as salix from the willow bark. I mean, we have used these to create synthetic versions of medications for so long that it is very important and effective when we know exactly what we're extracting, how we're extracting it, what that dose looks like, and what, again, the therapeutic action of the herb should be or should be expected to be. A really big point I want to make is herbal medicine does not equal safe medicine. There are a lot of herbs out there that can do damage to your body and even be fatal, taken at high doses or taken incorrectly. One of the biggest ones that I put a lot of caution around is St. John's wort. It's a really commonly marketed herbal remedy for depression and low mood, and it's also an antiviral. However, it is something that inhibits a liver enzyme from metabolizing other medications, actually speeds up the enzyme in its metabolism. And so those medications or supplements are less effective in your body. So an example is if somebody is on birth control for some reason and they get prescribed St. John's wort and take them at the same time, their birth control could be ineffective. So it's definitely something to be aware of. Again, I always say or suggest talk to your naturopathic doctor, whoever they may be, before you try an herbal remedy. Make sure that they're checking with drug interactions. I mean, just to show that not everything is safe. There is a book, Herbal Contraindications and Drug Interactions, plus Herbal Adjuncts with Medicines, that we're all pretty familiar with, to know that if you're on a certain subset of medications, what herbs are safe, what herbs may be unsafe, and how to take them to become the most effective. So again, it's not just as simple as I'm taking a plant, so it must be safe. Are there any questions so far on that part? Again, this is kind of a Q&A thing, so I want to make sure that people are able to speak up or ask questions or chat a question if you have one. Good. So I love the positive feedback. Thank you. And also just want to make sure, is anybody on an herbal supplement that they have questions about or want to know anything in particular about botanicals, or shall I just keep chatting? I think you all should have had some coffee. So there's a couple resources that I'd like to share with you. And I'm going to share my screen here really quick if I can find how to do that. So this website here is called the Naturopathic Herbalist. And this is an ND, Marisa, what's her name? Marciano. She also wrote this book, Botanical Medicine. And so it's a real simple, straightforward guide on herbs, the contraindications, what they're used for, the pharmacology, the pharmacognosy, which is how herbs work in the body, and medicinal uses and how to take them. And then she also includes references and research for all of the herbs that she talks about in this book. So this is a resource that I use on a daily basis when addressing any health complaint or looking into a quick, hey, does this contraindicate with something, or is it indicated for my patient? Or sometimes I look at, hey, somebody wants to balance their hormones, and here's really what we're looking at. What is the best herb for that person? There's a lot of herbs that can help with lymph. There's herbs that can help with bile flow and blood flow and venous return and blood pressure. So we have a whole array of herbs to speak about and to use at our discretion. And sometimes then that's when the individualized medicine comes into play, is that we can choose the herb that not only is good for venous return, but maybe also helps with vascular integrity or blood pressure. And in that way, we have that individualized medicine ability to utilize. So I wanted to share this website with you where you can look in here. And again, you can look at Herbal Actions. So what are my bitters? And when you click on that, that'll show how the bitters work. And then it'll also show, okay, here are some secondary actions that they may have. And then here's some herbal examples of what bitters may be. And then again, we look through, are there any allergies? Are there any contraindications with current medications or other supplements? And is this something that the patient can tolerate? And then again, you can go through Latin herbs, common herbs, plant constituents to learn a little bit more about how and why we would extract certain herbs for certain reasons. So that's that resource. I think I just stopped my screen sharing there. Gina wants to know if, or Jenna, I'm not sure how to pronounce that, if we can consider mushrooms part of the botanical world. Absolutely considered part of the botanical world. I would also say that that would probably require a whole different lecture and field of study. I have a lot of colleagues who are just studying the medicinal properties of mushrooms. Gina, thank you, because they are, in kind of a world of their own, and I do consider them botanical, but also a whole different expertise that, to be quite honest, I have very limited scope on, very basic knowledge as a naturopath. So I do, like I said, love mushrooms and use mushrooms, but the full extent of their medicinal power, I think, is really yet to be determined. They're a phenomenal resource. So I'm going to pause again and see if anybody has any questions or specific routes they want to take this conversation, and then I can kind of keep going on formulations. Okay, well, I'll keep chatting. So I kind of mentioned a little bit about individualized medicine. When we have this option, you look up herbs by action and it lists 7 herbs, and then you can choose which one would be best. I think this is where naturopathic doctors really shine, is the individualized medicine. Herbs are a very potent medicine, especially when we're following the recommended dosing to get a desired effect. And when we can formulate what's called a tincture for you, we really harness the individual constituents to do the actions in the body, either biochemically or physiologically, and sometimes energetically as well. And then we can mix and match those herbs in a way that they're able to work together. Some herbs do work better with others, and pair them together to get a better desired effect. So again, I have many patients who, I do a focus in neurology. So, hey, I have brain fog, or I'm a little slow to remember names, or I'm just noticing that my memory is going a little bit, and also I feel kind of tired. And oh, by the way, I have high blood pressure. And there's just a few little things that we want to really hit on through the entire body. And I would say, well, if you were in a conventional medical setting, you would see a neurologist for your brain, and a cardiologist for your heart, and a urologist for your kidneys, and maybe a mental health specialist for depression and anxiety. And we go to all these different physicians, which is wonderful, and they have their specialties and they have their expertise. And then maybe you get 4, 5, 6, 7 different pharmaceuticals from those visits. And then from those pharmaceuticals, they have a side effect profile that then we have to address as well. I think the really powerful thing about botanical medicine for naturopathic doctors is when we have the ability to zoom out and say, this may be affecting that, which may be affecting this, and kind of be able to find those trends and connect the physiology and biochemistry together in a way that makes sense. We can address root cause and also use herbs as medicinals in a way to say, I can formulate this specific tincture with 4, 5, or 6 different herbs rather than 4, 5, 6 different pharmaceuticals that will really work with the body's physiology. And what I mean by that is a lot of times the mechanism of action when you get prescribed a drug will be listed somewhere. And most of the time it's rather suppressive, because that's what we're looking for is, hey, we have a symptom, we want to suppress it, we're going to take a medication that does just that. What herbs tend to do is use that physiologic process of the body's own mechanism and push that process forward in a gentle way. So typically when I prescribe herbal medicine, I say I don't even expect to see a result immediately, because we're filling the bucket back up. We're supporting that biochemistry. We're supporting that physiology in a way that's working with your body's own natural abilities. And in doing that, we should start to see gentle improvements. I think the best compliment you can receive from a patient is, hey, how are you feeling? Oh, I'm not sure I'm doing really any worse. And then you start diving in and it's like, oh, I'm actually doing a lot. No, I don't have that pain anymore. No, my blood pressure is regulated. No, oh yeah, I am remembering names a little bit better. So it's such a gentle change and improvement in overall health that's where we can kind of eliminate some of that side effect profile, because we're not suppressing anything. We're really enhancing the body's ability to do what it was designed to do. Again, that's not to say that there aren't side effects from herbs. I see that often as well. So it is really important. Again, I think even more important to understand the dosing that you're on and the rationale for being on specific herbs for a specific condition. So we can make sure to tweak either the dosing or the herb that we're using based on your symptoms. So again, I'm going to pause here and cross my fingers that someone's got some questions or some input, or I've stimulated some new questions. So Gina wants to know if I recommend taking an entire herb more than using a tea. It really does depend. So the teas are really effective for specific conditions. So if we're looking for tonics for overall helpfulness for the body just to function in a rather well state or healthy state, then I love the whole herbs. And sometimes teas will have the whole herb in them. When we do prescribe a tea, then it is for the specific, like I said, we break it down into constituents. We're looking to extract a certain constituent, either from a cold infusion or a hot infusion. If you're using a hot infusion, sometimes we want you to cover with steeping. Sometimes we don't, because those volatile oils can be volatile or they can be medicinal. So it really is a science and an art when you're not just prescribing medications, but how a patient takes the medication. So tea is not just as easy as tea. What I've tended to notice is bagged tea tends to be less potent than loose leaf tea. And so when I prescribe somebody to take a bagged tea, I'll usually say take at least 2 to 3 tea bags per 8 ounces of water to get a therapeutic dose of the herb that we're using. So entire herb more than a tea, it's kind of apples and oranges, I guess, in that realm. But I do love teas for, like I said, a direct therapeutic purpose for sure. So hopefully that answers your question. What else? What can anybody kind of participate here and let me know why you're here? What interested you in the topic, or what the hope was that I would cover? Because I want to make sure I'm meeting goals here too. So I guess another point that I wanted to make, I'll just keep going here, is I already mentioned that not all herbal medicine or botanical medicine. Thanks, Stacy. Yeah, it's my first choice in medicine as well. So Stacy says herbs are her first choice. I'm a huge proponent of herbal medicine, botanical medicine. If you've been a patient of mine, typically I'll offer to formulate a tincture before I offer even a nutraceutical or a supplement, and definitely before a pharmaceutical for the most part, unless we're doing life-saving medicine, which herbs can also do. So I think it is really important to understand that when we're talking about medicinals, when you're talking about acute situations, things that are not necessarily chronic, that herbal medicine, individualized formulated tinctures can be so potent and really helpful. I mean, we're using them for viral infections. We're using them for urinary tract infections. I use them for just really about anything, blood pressure tonics and different things like that. So I think that it's absolutely my first choice as well. I love the nutraceuticals, but you kind of get into the, can you digest and absorb the capsules and whatnot? So I trained under the great Eric Yarnell. If anybody's really into herbology, Eric Yarnell is a naturopathic doctor that's pretty much world renowned for his research into herbs. And I trained under him in school, learning how to formulate and make tinctures and dose tinctures, which I think is the part that falls out a lot in the medicine and naturopathic medicines. Are we dosing appropriately for the desired therapeutic effect? So I'm going to finish one thought here, and then I do want to come back for herbals for arthritis. But I kind of mentioned already, you know, herbs aren't always necessarily safe, and that they do have a side effect profile. And I also want to hit on the other end of that. I tend to be a little more integrative sometimes than some of my counterparts, but I want to also recognize that not all pharmaceuticals are also bad. Some of those pharmaceuticals that we develop as a synthetic version of either herbs or natural hormones or constituents of our own body can be almost the most natural thing we can give our body. And I usually use the example of giving insulin to somebody with type 1 diabetes. When we give a synthetic version of insulin to somebody with type 1 diabetes, that's life-saving medicine that their body can't make on their own. And a lot of times, you know, I work with a lot of people with Parkinson's, and the medication of choice is dopamine. And again, we have a synthetic version of that. You can also get dopamine from a mucuna bean or a fava bean. Contains a large amount of dopamine. So that can be really helpful and really medicinal. I think the tough part about that, again, is that standardized dosing ability to be able to manage a disease process like that. And then also recognizing that levodopa can cross a blood-brain barrier, but carbidopa cannot. So we need to start pairing those things. So I guess my point in all of this is that if you're going to see a naturopathic doctor that has limited knowledge in pharmacology, which is conventional pharmaceutical medication, then I would really ask that you ask those questions about, hey, is this having a desired effect? And does this interact with my pharmaceutical medications? Or is there an option out there that might be easier to use and then help support my body through a side effect profile? The reason is because we do need to be able to have the information on both sides. We need to know our herbal medicines and the pharmacognosy of herbs and their constituents and how they work in their body. And as physicians, we also need to have that knowledge base of pharmacology and conventional pharmaceuticals. So Stacy said, interested in herbals for arthritis. So I think this is a really cool time, actually. And I'll share my screen again. So my favorite arthritis herb is Andrographis. Let me see if I can find, where's my other? Stop share to find my website here. Sorry, bear with me here, guys. I'm finding my website. Just go here. So the naturopathic herbalist and Herbal Actions. Let's see, she's got arthritis listed down here. So anti-rheumatic. So anti-inflammatories, alternatives. And so here's a few herbs that can be used as anti-rheumatic or anti-pain, which would be useful for a musculoskeletal disease, including arthritis. So devil's claw, wild yam, turmeric. I'm sure a lot of people have had turmeric or curcumin. Gotu kola, which is one of my favorite herbs, celery seed, and arnica. So this is a great, again, resource that you would be able to go to and say, hey, here's a condition that I'm having, and I would like to know what can be helpful for that. Like I said, I really love Andrographis for arthritis and use that quite a bit. Depending if you have muscle spasms with the arthritis or it's just general inflammation, we need to know really what's going in there. So another favorite that I have for arthritis is Bromelin, which is the active constituent in pineapple. And Bromelin is what we call a proteolytic enzyme, and we take it without food. And essentially what we do when we take that out without food is it goes into our bloodstream. And I always think of it in my imagination as a little Pac-Man. And it goes through and it eats up all these aggregates of inflammation. If somebody has blood sugar dysregulation, it can eat up those little sticky spots of blood sugar where it shouldn't be and help clear out that joint space. Now, again, we think about this in the zoomed in lens. Okay, now we've broken it up. How do we get it out? So I want to talk about hydration. I want to find a good lymphagogue. I want to find a good muscle relaxer so the muscles aren't so tense around that joint space so that things can flow in and out. I would talk about contrast hydrotherapy. How do we dilate and constrict the vessels in a way that we're bringing nutrients in and then we're squeezing the nutrients back out? I want to talk about venous tonics, things that are going to enhance the venous flow back to the heart so we can dump those toxins and inflammatory cells into the lymph system to then use our lymphagogue to clear it out. Are your organs of elimination working properly? Are you using the bathroom, both number 1 and number 2? Is your liver and kidney function working? Are you sweating on a regular basis? And are you breathing effectively? I think when we talk about the 5 organs of elimination, we leave out lungs a lot because we don't concentrate on breath work. And it tends to fall into this category of, meditative practices, or we need to do breath work because it's good for us. But at the end of the day, we need to do breath work because that's where we exchange oxygen and carbon dioxide. And if we don't have effective oxygen CO2 exchange, then we're not getting oxygen, which is an essential nutrient, into any of these spaces, organs, bloodstream, muscles that we need to operate effectively. I mean, this is an essential nutrient for life. So we talk about all of these things. And when you say herbals for arthritis, that's just a quick glimpse into my brain of, yeah, let's treat arthritis. And also, why is it there? And when we treat it, how can we optimally treat it? Do we just go in there and lower inflammation? Because if that's all I'm doing, then I may as well be a conventional doc. Even though I'm using herbs, it's the same approach as, here, let's just lower the inflammation. I want to not just lower the inflammation, but understand why it's there, get it out of your body so it doesn't come in there again, and then really optimize the physiology of the supportive and compensatory mechanisms there. So hopefully that answers your question and a little bit, Stacy. I tend to get on a roll sometimes with those kinds of therapeutic questions. But yeah, tight muscles, we've got skullcap, we've got California poppy. Sorry, I just got a notice from Zoom that we can continue on past 30 minutes. Oh my goodness, there's so many anti-rheumatics out there. So again, and that's when I would really say, is there anything else that you have going on, or is it only arthritis? Can we get a twofer out of a specific herb that's going to address arthritis and vascular insufficiency? So those are all really great questions to ask. What else do you guys have out there? Thanks, Gina. I appreciate you being here. Thank you, Stacy. I appreciate you being here. As always, guys, if you can jump on and invite your friends for the next ones. Like I said, we're again trying to get out in the community and make sure that we're being supportive and active in our community. So social media wise, it's always helpful to get some feedback. Amy asks, mood lifting herbs that isn't too much. So yeah, I mean, I think there's quite a few out there. Again, there's always going to be the question of what's going on with your moods and where is that coming from. Conversation I have with a lot of people who have some low mood, of course, is a vitamin D deficiency, seasonal affective disorder, and then also their gut health. So herbs definitely used as a medicinal, and I can chat about a few here in a moment. But also it's really important to know that, your gut is responsible for making more serotonin in the body, which is our happy hormone. And it's the one that a lot of antidepressants will target. It's actually responsible for making more than your brain. So while we give the brain credit for our neurotransmitters and our moods and our hormones, our gut health is really imperative for that. And what I tend to see when I have this conversation with patients is just this huge sigh of relief, is that, oh, my IBS or this bout of antibiotics that I took or whatever the case may be actually participated in my mood. And it's not, my fault, or this isn't something that I'm stuck with forever, and that it can be something worth addressing. So when I'm talking about herbs to address mood, the very first thing is, what part of the mood dysfunction or physiology are we addressing? Are we helping with gut health with herbal antimicrobials? Or are we using herbs to help balance out hormones, maybe through perimenopause or postpartum, that can actually help balance the estrogen progesterone levels to help the mood stability through those processes? Premenstrual syndrome is another time where we have mood shifts and irritability and inconsistencies in our stability of mood, where we can find a lot of use from seed cycling and different herbs to help on that front. If you're looking for a straight up mood enhancer, like I said, I don't see any that's better than St. John's wort, as long as it's dosed appropriately away from other medications. It is extremely effective and not too much. It's a lovely herb. If anybody's ever seen the flowers in the springtime, they're just brilliant. These bright yellow flowers that I think just looking at them could lift your mood. So that's a really great one. I love lemon balm for mood, and lavender. I also will love a California poppy, a little bit of kava. I'm trying to think of, and those are, maybe more anxiolytics or nervous system relaxers, nervous system tonics. But also when we tend to calm that nervous system down a little bit, we can relax that fluctuation in our moods or irritability. But really, my primary focus or herb of choice for mood enhancement is the St. John's wort. So hopefully that's helpful for you, Amy, and we can, chat some more offline or continue the conversation here if there's something else that you wanted to address. Other things about mood, so adaptogens, ashwagandha, licorice, those are really great for your adrenal glands, which are responsible for that stress response. So supporting them can also help support your mood. So I really enjoy that. And again, I can't say it enough. If there's something that you're interested in or we're hearing here, this is not medical advice. I really do suggest that you see your primary doctor about dosing and whether or not it's appropriate for you. Some of those herbs that I just mentioned can actually affect thyroid function and adrenal function and blood pressure. So it's not as benign as it may seem if, take licorice for an adaptogen, because actually licorice has been shown to increase your blood pressure. So if you're having blood pressure issues, then it's not an ideal herb for you. So again, make sure you're consulting a physician, ideally a naturopathic physician, about herbs and how to use them appropriately. Another really great way to use herbal medicine is for mineral replacements. So I'm just kind of browsing through my book here to find some really great sources here. So we're talking about vitamin C herbs, B12, minerals, manganese, phosphorus. So they have, herbal sources and dietary sources. Selenium, a really important cofactor for our thyroid function, can be found in herbal sources like hibiscus and milk thistle and yarrow and valerian and marshmallow. And then also they give, there's dietary sources as well. So there's a lot of, like I said, rationale and use for using a personalized, individualized tincture for your health picture. And when you go see your naturopathic physician, this really would be the place that I would request to start is, hey, I want I want personalized medicine. This is why I'm here. I understand that my symptoms are unique to me, and therefore your medicine should be as well. And I think that's exactly what botanical medicine allows us to do. Any other questions? Anybody want to unmute and chat about, give a testimony of herbs? Talk a little bit more about taste?
Yeah, Karin, I wanted to ask you, and I'm really breaking all the rules. I'm driving my car while I'm doing this. Yeah.
You're wearing your seatbelt though.
Yeah. And I'm only driving 25 miles an hour, so that's good.
Okay.
We had talked briefly, but about how all of us have some inflammation and more as we get older. And I'm taking curcumin, and I was told by my doctor that it had to be something like 95% curcuminoid. Can you explain anything about that and the effectiveness of inflammation?
Yeah, absolutely. That's a great question. Thanks, Leah. So essentially the 95% curcuminoids, so when we talk about, I mentioned before, constituents of certain herbs or plants that are expected to do the job in the body. And when we extract those specifically for a therapeutic effect, we need a certain percentage or amount per extraction to make that standardized dosing, if you will. So this hits on two fronts, the quality product. So if you go to a product and it says turmeric and you buy it over the shelf and it doesn't tell you how many curcuminoids are in it, I would say put that back right away. If it's not even on the label of what the percentage of active constituent is in it, then it's probably not going to meet the requirements for dosing. And then what you do want is you want that certain percentage, and essentially it's because a bunch of brainiacs and research scientists, made up hey, this is what we are seeing we need to have when we standardize the constituents from turmeric. So when you take the rhizome or root and you take out the constituents, then that much percentage per dose needs to be available to have the desired effect. Now, curcumin, which is the active constituent of turmeric, is a really phenomenal anti-inflammatory, because when we talk about typical NSAIDs or anti-inflammatories, non-steroidal anti-inflammatories that I usually use turmeric as a replacement of, they're what's called a COX-1 or COX-2 inhibitor, which is an inflammatory pathway right before the body releases these inflammatory cells. So it's happening upstream a bit, but not quite a bit. Turmeric has actually been shown to be what's called an NF-kappa beta inhibitor. And we're talking about chronic inflammation. The etiology of a lot of cancers happens from a breakdown of NF-kappa beta, and then the ensuing cascade of inflammation that comes in the body with COX-2, which is where we have the other pharmaceuticals coming way downstream of that. So turmeric hits this way upstream in the inflammatory pathway and inhibits that from happening. So it's a really potent anti-inflammatory that works, like I said, upstream of the effects of the body releasing as a result. Now with that curcumin, what also isn't told, unless you are, like I said, seeing a physician, is that taking it with black pepper or having black pepper in the formulation will actually help the absorption into the body and help you utilize it better. And also taking it with a cream or milk or thickening agent can also enhance the availability. So hence, an old Ayurvedic tradition in Indian culture is golden milk, which is turmeric and milk and black pepper that they've been using for rheumatologic pain for probably hundreds of years. So
kind of almost like a chai of some sort.
Yeah, except it'll leave your teeth orange.
Yeah. Well, so the big, I hear so much about people saying, oh, well, I take turmeric, and I've always, in my mind, said, well, turmeric is like nothing compared to the curcuminoid. So when someone says, oh, I put turmeric on all my food, how is that comparing to, curcuminoid?
It's going to be probably a little less potent because, again, we're concentrating the active constituent of curcumin in the supplement. So when you're taking the supplement and they have to prove that they have 95 or 98% curcuminoids, that's showing the potency of that active constituent for a desired effect. Now, like I mentioned before, sometimes whole plants can work really well and synergistically with the body. So somebody who's been cooking with turmeric for their entire life because of their culture or because of they just love the taste of it, or that's something that they've done, I would say compared to an age, related person may have less overall inflammation in their body because they've been using it in that way for so long. And that whole plant effect can be really great for you. Now, again, when we're using it for therapeutic dosing, it's not that much different than a pharmacologic intervention. We want to make sure that, hey, if I'm taking 500 milligrams of Tylenol, every single capsule that you get in every different bottle is going to have 500 milligrams of that active salicylate in it. And just like turmeric, if I'm going to take turmeric, I'm going to want this 95% extraction of the active constituent to have that effect in my body every single time I take it. And that's where we really hit the hiccups in our profession, is because not every distributor or company will meet that potency or meet their label marketing. And so the consumer will say, oh, this doesn't work for me, or they're not taking enough, or it's not dosed appropriately, and therefore can be ineffective. So,
well, I appreciate you saying to really look at turmeric supplements to make sure they list the curcuminoids that they provide.
Yeah. And I mean, a general basis, if you're going with botanical medicine, and there's a whole science behind it. And I don't even pretend, like I said, I studied under Eric Yell now, and he'll teach you the pharmacognosy of every single herb and how to extract it. And really, I follow the genius of the people who are willing to do that kind of work. Because even if you're going to be a consumer of botanical medicine, I say consult your physician, because there's so many nitnoid things to know about. Even with a tincture, the tinctures that I formulate here, were they extracted properly? Was it an alcohol extraction, or are we infusing it? When we talk about teas, does it need to be a cold water tea or a hot water tea? So there's much more science behind the efficacy of herbs than I think we'd like to think. It would be really lovely if you could say, hey, I'm going to walk down the street and pick some lemon balm from my neighbor's bush and make some tea. Yeah, that can be useful. But if we're treating a condition with herbs, and I think there's a big difference there, if we're providing this tonic for our body in a healthy state, then great. You take herbs and you support these physiologic processes, and you understand that, that's also a different realm. But when we are treating conditions with herbs, when we're treating physiologic disease or conditions, then there really is dose appropriate, constituent-based side effect profiles, contraindications. There's a lot to be explored there on a scientific realm to ensure that they're safe and effective.
Okay, thank you.
Of course. Anyone else have any questions before we sign off here? We've got a couple more minutes. The chat tends to be delayed about a few seconds. So there you go. Where do I recommend purchasing herbs? That's a good question. I mean, right now, so I'm in northern Idaho. I don't know where everybody's signing in from. I'm in Coeur d'Alene. So, I guess I have a little bit of bias, but because I do so much work in ensuring that the quality assurance product is there, then I would say your naturopath is really understanding, hey, that they're doing the sourcing and quality assurance, and they will have herbs for you. I know if you are in this area, there's some natural food stores that are really helpful, that have done really great quality sourcing of their herbs in bulk as well. So that's a great place to ask. And it's always, it always behooves you to say, hey, have you sourced these herbs? Do you know about them? There's a couple online products or online websites that I really like for sourcing herbs. One is Botanica. That's Dr. Tori Hudson's business, her supplement industry, and she does a lot of herbal medicine. And there's Heron Botanicals, and that's Eric Yarnell, so Middle of Nowhere, South Texas. So online, Laura, would be a great place for you to start. And I know a lot of naturopathic clinics have online dispensaries as well. Like I said, Heron Botanicals. Mountain Rose Herbs is a phenomenal company. They're out of Oregon. Very familiar with them, and they do a great job with their Herbology, the Botanica. So yeah, there are quite a few out there. And I think the best thing to do is if you see a company or find a company, just ask them, are you sourcing it? Do you have a registered herbologist on staff? That is actually a thing and a certification that would be really useful for you to know if you're going to purchase herbs. And again, if you're purchasing herbs, that's wonderful. Keeping in mind that dosing appropriately and finding that therapeutic effect, there's an art and a science to that as well. So consulting a professional to help you take those effectively is also encouraged and recommended. So I guess to wrap things up, unless anybody else has any questions or wants to chat some more, herbs are powerful. They're not always safe. They're not always the right answer, but they can be. And there's an art and a science to treating conditions with herbs that I think is really necessary to have professional guidance around. I did offer a couple of resources. Like I said, Dr. Mauricio Marciano's website, which is the Naturopathic Herbalist, is a phenomenal place to start. Rosemary Gladstar, I believe, also has a website. She's a famous herbologist, naturopath who does a lot of herbal medicine. Eric Yardnell is also starting an herbal medicine website for naturopaths that we'll all be able to reference for dosing and formulating. And then again, just ensuring that your physician has the knowledge base or the resources to be able to use their herbs in the most effective way. Because again, we want to ensure that you're getting your conditions treated and you're also staying safe. The last plug that I'm going to make before we sign off here is, I mentioned it right at the beginning, is that, the human race can't exist on the planet without our herbs, without our plants. We're literally breathing out their exhales. So sustainable harvesting, if anybody wants to harvest or source their own herbs, I really encourage you to do the research on respecting Mother Earth and doing that in a way that's appropriate and understanding, are there herbs that are endangered? Are there plants that are endangered? Is the company that you're using, if you're going to order a company, do they practice sustainable harvesting practices? And just understanding, like I said, it's not indefinite resource. It's definitely something that we need to respect and address as we go through our harvesting or our sourcing, and understanding that it does create a downstream effect or a ripple effect for the entire planet when we are not sustainable or respectful. Okay. Well, if anybody does have any specific questions, I'm happy to field those here over the next week. Our email is info@cdahealingarts.com. You can just mention that you came on the webinar and you had some questions for me, and I'm happy, like I said, to answer those over the course of the next week. I also offer free 15-minute consultations if you had any more questions about herbs or wanted to know how to most effectively utilize things for your own personal health picture. I'm available as well. So it's been a pleasure chatting with you all today, and stay tuned. I believe Dr. Hunter is hosting the May session Zoom call, and it'll be the first Thursday of May, and I don't know what the topic is yet. So stay tuned, jump on social media, give us some feedback, let us know what you want to learn. We're picking topics out of a hat here, but if anybody's got something specific that you want to learn about, then use and abuse us. That's what we're here for. Take care, everybody. Cheers.